Today we're going to talk about mid-back pain and why might you be getting mid-back pain. So a lot of times that pain happens right here, just kind of middle of your back, between your shoulder blades or slightly below. And it's a tension feeling that you get, usually a tension and a tightness, not quite a pressure sensation is the way most people describe it to me. And that often comes on due to a variety of reasons. Part of it can often be sitting posture. We often sit and we're kind of here. So we're hinging right there at that area. And as we hinge at that, it starts to cause a lot of discomfort for people and tightness. We tend to get tightness between the ribs, basically, where our shoulder blades are. And we don't open up our chest. We don't stretch that area very much. So that is one reason that I do advocate using a foam roll for people. And in that case, I'm not looking for a myofascial release. So we have that fascial layer that covers our skin, right? Well, underneath our skin layer. It covers our muscles and breaks them up into different components and the compartments, essentially. With that, I'm not worried about what that fascia is doing with the mid-back as much as I am worried about wanting to get more mobility at the spine again. We tend to get a lot of tightness in our thoracic mid-back spine region, and that happens to be more joint related. So that tightness you can typically then work on putting the roll out, and you're gonna wanna lean back and do different repetitions segmentally down the spine. That's going to ease up some of those symptoms, give you a little bit more mobility, but it tends to be a issue of posture as well as a little bit of weakness from surrounding muscles. So stretching and mobility, those are your keys to helping get better with mid-back pain. Now, if it's continuing and you're getting like a burning sensation, a tingling sensation, you get some symptoms in your arm or things like that, then you need to see a specialist so you can differentiate between, is it really coming from my mid-back and thoracic area, or are these symptoms actually more spine related, a nerve related, possibly a disc? There's a lot of things that go on in that region, but the most common thing that I see people with mid-back pain is usually mobility at the thoracic spine decreasing. And we don't use that area very often as we should. And we tend to slouch forward and round forward, and that's going to cause more pressure onto that area. As we can stretch out our pec muscles, bring our shoulder blades back, stand with good posture and feel good again, some of that mid-back pain goes right away. And it's amazing how fast some of these things can truly be healed and fixed. So I'm Dr. Shari, orthopedic physical therapist with Athletity Movement Clinic, and I'm happy to help you today with this mid-back pain that you're reaching out and looking for some answers with. Have a great day.